The subcommittee will reconvene, and I see our second panel is already seated. Let me introduce each of you. On my left is Mr. Michael Ambrosio, who is from the Food Marketing, or representing the Food Marketing Institute, and he is the Vice President for Quality Assurance Division at Wakefern Food Corporation. Next, we have Ms. Pamela G. Bailey, who is President and Chief Executive Officer of the Grocery Manufacturers Association. And then we have Ms. Caroline Smith DeWall, who is the Safe Food Coalition Food Safety Director of the Center for Science in the Public Interest. Dr. Tim F. Jones, who is a state epidemiologist from the Tennessee Department of Health. And last is Mr. Thomas E. Stenzel, who is President and CEO of United Fresh Produce Association. Welcome. You know, it's 5 minutes, and obviously your statements become part of the record if you want to include material more than the 5 minutes. And we all heard before, I know some of you were wondering if you can meet the deadline, but since we do intend to go to markup next week, I agreed with what Mr. Who brought it up? Mr. Shimkus said about we'll give you any additional written questions by the end of business tomorrow, and we'd like them back by Monday at the end of business. So we'll start with Mike Ambrosio. Thank you for being here again.
Thank you. Chairman Pallone, Ranking Member Deal, and members of the Health Subcommittee, I am honored to appear before you today on behalf of the Food Marketing Institute to present our views and suggestions on the Food Safety Enhancement Act discussion draft. FMI and its member companies share the common goal of enacting legislation this year that will genuinely improve the safety of the food supply. Steps that actually prevent the presence of adulterants in the food supply are the only true way to improve the safety of our food. I am Mike Ambrosio, Vice President of Quality Assurance for Wakefern Food Corporation. I have been in charge of food safety programs at Wakefern for 30 years. Founded in 1946, Wakefern has grown from a small, struggling cooperative into the nation's largest retailer-owned non-farm cooperative in the United States. We are headquartered in Keesby, New Jersey. Wakefern, along with its ShopRite stores, employs over 47,000 individuals in New Jersey, New York, Pennsylvania, Delaware, Connecticut, Massachusetts, Rhode Island, and Maryland. Today, I am also representing FMI, a national trade association that has 1,500 member companies made up of food retailers and wholesalers in the United States and around the world. FMI members operate approximately 26,000 retail food stores with combined annual sales of roughly $400 billion, representing 3/4 of all retail food store sales in the United States. FMI's retail membership is composed of national and regional chains, as well as independent grocery stores. This morning, I will present several of FMI's recommendations for revising the bill, but I ask that my entire statement be included in the record. In April 2008, I testified before this subcommittee on legislation that would have modernized and overhauled the food safety systems at the Food and Drug Administration. Since that time, high-profile food safety outbreaks and recalls involving tomatoes, jalapenos, peanuts, and pistachios have not only made headlines, but regrettably have caused illness and in some cases even death. Many of the themes and ideas that I share today will be similar to those that I shared in 2008, but there are differences that reflect lessons learned and new weaknesses in the existing food safety system identified from these latest recalls. As the purchasing agent for the consumer and the final link in the supply chain, our industry understands that it is vital to ensure that the FDA has the necessary authority, credibility, and resources to meet the challenges of today's global marketplace. Consumer confidence remains an essential factor in this debate. Food safety issues can be extremely complex, and consumers vary greatly in their knowledge of the science and other issues affecting the safety of our food supply. However, as food safety issues draw national headlines, consumer awareness has a concern about the safety of commercially prepared food and products purchased at the supermarket heightens. Mr. Chairman, I applaud you, Mr. Dingell, Chairman Waxman, and all members of the committee for your efforts to address changes that are needed to improve our food safety system. We support many of the proposals in the draft by emphasizing the need to have preventative measures be the foundation on which the food safety system should be built. The draft also recognized that we need to focus on the majority of resources on facilities and products that pose the greatest risk of contamination that could result in foodborne illness or injury. We must continue to be sure that any changes meet certain criteria, be supported by science, have measurable benefits, be affordable, be realistic, and be implemented without unintended consequences. First, we applaud you for not only designating an entire section of the bill solely to prevention, but also putting this first and the most extensive section of the bill. From our perspective, this is the appropriate emphasis. In addition, I would like to specifically comment on certain sections of the draft. FMI recognizes that a strong public-private partnership is needed to help ensure safety of the food supply. Although every penny counts in these tough economic times, there is nothing more important than improving and ensuring the safety of our food supply. We are willing to support a fair registration or user fee, provided that it is utilized by the FDA in a transparent and accountable manner to improve the safety of our food supply through means such as conducting research and consumer education programs. We look forward to working with the committee to address our concerns about how the FDA may utilize any fees collected. We support the requirement that every registered food facility conduct a risk assessment and implement and maintain a validated food safety plan and identify potential resources of contamination and appropriate food safety controls and document those controls that will prevent, eliminate, and reduce potential hazards. Adherence to food safety plans goes a long way towards developing a culture within a company that is critical to ensuring food safety. Mr. Chairman, thank you for the opportunity to testify. We appreciate the work that has gone into the development of the Food Safety Enhancement Act discussion draft with the goal of improving food safety and the food supply and helping to restore consumer confidence in the food safety system. I look forward to your questions and remain available to the subcommittee. Thank you.
Thank you. Ms. Bailey?
Thank you, Mr. Chairman. Good afternoon.
I don't know if that's on the mic. Oh, you don't have a mic.
Another mic. Thank you. Yeah. I'm Pam Bailey, and I'm President and CEO of the Grocery Manufacturers Association, which represents more than 300 food, beverage, and consumer products companies. Americans enjoy one of the safest food supplies in the world, but we recognize that steps can and must be taken to make our food supplies even safer. We applaud Chairman Waxman, Chairman Emeritus Dingell, Chairman Stupak, and Chairman Pallone for developing the discussion draft of the Food Safety Enhancement Act of 2009. Product safety is the foundation of consumer trust. We look forward to working with the committee to quickly enact food safety reforms that will restore consumer confidence and will continually improve the safety of our food supply. Although the food industry is ultimately responsible for the safety of our products, strong government oversight is a critical part of our food safety system. That is why GMA supports much in the discussion draft, including your proposal to set safety standards for fruit and vegetables, your proposals to improve the safety of imported food and food ingredients, and your proposals to give FDA strong enforcement powers to deal with bad actors, including mandatory recall authority. In particular, we strongly support proposals to require all food manufacturers to conduct a hazard analysis to identify potential sources of contamination, identify appropriate preventive controls, and to document those preventive controls in a food safety plan. We believe that food safety plans are the cornerstone of prevention in that they will help ensure that safety is built in from the very beginning. We have proposed certain modifications to some of these provisions to your staff, and we look forward to working with you. In particular, we look forward to working with you to address your concerns about traceability. We recognize that the discussion draft instructs FDA to assess the costs, benefits, and feasibility of traceability technologies and gives FDA the power to exempt certain foods. Furthermore, we recognize that the discussion draft instructs FDA to conduct pilot projects and public meetings. However, we believe that these studies, meetings, and pilot projects should be completed before FDA decides whether and how to assign the food industry the responsibility for tracking a food product and which coding and identification systems may be best suited to this task. As you anticipate in the draft, the cost and feasibility of requiring every manufacturer to maintain the full pedigree of every ingredient in every food may outweigh the public health benefits. To address concerns raised during the peanut product recall, we urge you to consider whether intermediate distributors and brokers should include on the labeling of their bulk ingredients the identity of the ingredient supplier. In general, we support proposals to give FDA stronger enforcement powers, including the power to order a recall. We believe that certain enforcement provisions of the discussion draft, such as mandatory recall and suspension of registration, should only be exercised by senior agency officials when there is a risk of serious adverse health consequences, and should ensure that companies are afforded certain due process protections, such as an administrative hearing. As we saw during the recent recalls of tomatoes and jalapeno peppers, recalls can have a devastating financial impact, and they need to reflect the best science and wisest agency judgment. Finally, we strongly support efforts to provide FDA with additional resources. GMA helped create the Alliance for a Stronger FDA, and we have worked with other consumer and industry groups to increase FDA spending. If Congress enacts the FY 2010 request of the FDA and the Obama administration, we will have seen food safety spending at FDA increase by nearly 80% since FY 2006. More funding is needed. We look forward to working with the committee to identify an appropriate role for industry. Our industry is significantly increasing our own investments in food safety, and we are prepared to make additional investments to continually improve the safety of our food supply and to comply with many of the new mandates that are envisioned in the discussion draft. We are not opposed to all fees, and I am confident that the committee can reach a bipartisan consensus on the agency's resource needs and an appropriate role for industry. Let me close by saying again that the food and beverage industry is committed to working with you to quickly enact food safety legislation, which makes the prevention of contamination the foundation of our food safety system. Thank you.
Thank you. Ms. DeWall.
Thank you very much. Thank you for your leadership, Chairman Pallone, and also the leadership from many other members of this subcommittee and committee. And also thank you to you, Ranking Member Deal, for the many hearings that we've sat through. We've listened to the witnesses. It's just this work has been going on before this committee for a long time, and I think hopefully we are nearing an end. My name is Caroline Smith DeWall, Director of Food Safety for the Center for Science in the Public Interest, but today I am representing 10 consumer, public health, and victims advocacy organizations that are members of the Safe Food Coalition. Let me begin by saying that we believe this is a strong bill that will improve food safety. It requires food companies to build into their processes the conduct of regular hazard analysis, and they have to institute preventive controls to prevent problems from occurring. It provides a modern framework for food safety oversight to replace the antiquated food safety laws that have hamstrung the Food and Drug Administration. It gives FDA essential new authority to carry out the mission of preventing illnesses and outbreaks, and to inspect food plants much more frequently. And it addresses the funding issues urgently needed to institute the program improvements, doing this with a modest registration fee. The heart of any effective reform effort lies in prevention, which is in the bill's hazard analysis and preventive controls section. The bill provides FDA with new tools like written plans and access to processing records that will allow government inspectors to review the conditions in plants over time, not just when inspectors are in the facility. We recommend additional strengthening of the bill by requiring companies or labs to report pathogens on final product samples to FDA whenever they are encountered in a facility. This would give FDA an early warning of problems and might prevent another tragedy like the outbreak linked to the Peanut Corporation of America. It is a common adage that you cannot detect what you don't inspect. Random and frequent inspection by public officials is a necessary component of an effective food safety system. This legislation divides food companies into 3 categories based on risks and directs FDA to inspect the facilities every 6 months to 4 years. While this is a vast improvement over FDA's existing program, we continue to believe that more frequent inspections are needed, particularly of high-risk facilities. Risk-based inspection is a concept that expands across the entire spectrum of food products, not just those regulated by FDA. The registration fee, as proposed, is quite modest, and at $1,000 per facility, it should provide somewhere between $300 and $400 million in new revenue for food safety activities. Let's put this fee into context. In the Peter Pan outbreak, the average cost per victim reporting an illness was $2,650. And this is based on an estimate using the Economic Research Service cost calculator. So when there's an outbreak, consumers who are affected may pay over $2,500 or more. These are individuals. So clearly, a $1,000 fee on each facility to avoid these problems is more than reasonable, especially when compared to the costs of individuals and families that you've had here before this committee testifying on the severe impacts of foodborne illness. In addition, I'd just like to note that companies themselves can run advertising campaigns to promote their products that run into the tens and even hundreds of millions of dollars. To conclude, I just want to say that polling has shown that the public has lost confidence in the safety of food. The percentage of consumers confident in food safety fell to about 22%, according to the University of Minnesota's Food Industry Center. This legislation provides a modern framework for FDA's regulation of the food supply that will deliver many benefits to consumers, though it does stop short of structural reforms that we also think are essential. We appreciate your leadership, and we believe that these new authorities that you're proposing will, over time, prevent the outbreaks and illnesses and help restore consumer confidence. Earlier this year, members of the Energy and Commerce Committee made commitments to the victims of the Peanut Corporation of America outbreak that change would come to FDA. President Obama said, at a bare minimum, we should be able to count on our government keeping our kids safe when they eat peanut butter. We urge you, Chairman, to act swiftly to finalize this legislation and to enact it. Thank you.
Thank you. Dr. Jones.
Mr. Chairman and members of the subcommittee, thank you for the opportunity to be here today. Recent high-profile outbreaks demonstrate the huge challenges and opportunities for improvement in the nation's food supply, food safety infrastructure. Laws, policies, and to be frank, philosophies developed decades ago no longer suffice to successfully meet these new demands. The legislation we're discussing today is therefore a critical step in reviving the food safety capacities of the FDA. I work in a state health department as an epidemiologist responsible for investigating foodborne diseases and, in effect, cleaning up the mess left when things go awry in the food safety chain. I'm excited to see that this proposed legislation addresses many of the problems that I experienced firsthand in my role both investigating and helping prevent foodborne disease. Improving the traceability of food, as called for in this legislation, is fundamental to successfully achieving many of the other tasks described. If traceback information had been more promptly available and shared faster, I think that many of the problems associated with the recent tomato jalapeno incident could have been mitigated. And likewise, tracing peanut butter from one plant to 4,000 different commercial products would have been utterly impossible with many other types of foods. Ensuring that all foods are traceable efficiently and accurately is critical to maintaining food safety. Contamination of produce and foods which are eaten uncooked are of particular concern because consumers have less control over the safety of those foods in their own kitchens. Setting standards for pre-harvest food production starts to close a major current gap in the nation's food safety system. Suspected produce-associated illnesses are particularly difficult to investigate from both the public health and regulatory perspectives. While large food service corporations and their suppliers often have excellent quality control programs with impeccable records, many other companies don't. The portions of this bill requiring country of origin labeling, improved distribution records, and plans to regulate the safe production and harvesting of fruits and vegetables are important to help address these problems. I'm pleased to see that the agency is being encouraged to markedly increase the scrutiny of food handling entities. I'd like to emphasize the importance of basing inspections and product testing and any other interventions by the agency on sound science. The bill does have important directives to improve testing and the science base of the agency's activities. It's critical that from top to bottom, activities are more efficient and effective and not just more frequent. This bill's requirement that the agency's activities are risk-based is particularly critical. It's likely that as technology improves, the value of traditionally defined inspections will change dramatically, and I'd urge that the agency retain sufficient flexibility and authority to adapt to changes rapidly and with as few barriers as possible. I think it's important that in any discussion of the food safety system to emphasize the importance of interaction between FDA and CDC along with state and local partners. In meeting the directive to enhance the science of food safety and develop risk-based approaches, data from CDC and its partners on things like outbreaks, disease surveillance, and attribution of human disease to specific foods will be critical. It's imperative that such data are developed and shared cooperatively to meet the needs of all the partners involved in the system. In every discussion that I've been in pertaining to food safety, the importance and current inadequacy of effective information sharing is probably the most common single topic that's raised. I'm pleased to see that issue addressed in this bill. Improving the technological capacity to share information will be important in accomplishing this, but perhaps even more important is changing the ingrained policies of not sharing information among partner agencies far beyond any logical limit, even when the failure to do so threatens the public health. To meet the mandates of this bill, FDA will have to increase interaction and coordination with state and local agencies, which will require funding and focused attention. Federal regulatory agencies frequently are prohibited from sharing proprietary information obtained during investigations. Flow of information in both directions between FDA and CDC as well as state public health partners is critical. Examples of this include such things as distribution lists during recalls, information on suspected products or producers, and information on potentially exposed people. The FDA, CDC, and other partner agencies must have both the authority and expectation to share actionable information with public health partners to the extent necessary to protect the public's health. And I'll conclude with a final comment about the importance of ensuring FDA and its state and local partners have adequate resources to meet the responsibilities with which they're charged in this bill. No one would argue that the FDA is currently underfunded, overworked, and essentially overwhelmed. State and local food safety capacity must also be robust in order to maintain an effective food safety system. Adequate and consistent funding and resources must be dedicated explicitly to sustain the food safety programs at FDA, as well as the state and local partners who work with them to keep the food supply safe. Americans will eat 1 billion meals today, and I can't think of a better investment than one that will keep every one of those meals safe.
Thank you, Dr. Jones. Mr. Stenzel?
Good afternoon, Chairman Pallone, Ranking Member Deal, and members of the subcommittee. I'm pleased to be with you as you know that the fresh produce industry has been a leading proponent of strong federal government oversight of food safety. My name is Tom Stenzel. I'm President and CEO of the United Fresh Produce Association. Our organization has been privileged to testify 10 times in the last 2 years before this committee or other members of Congress, perhaps only runner-up to Caroline on this panel. Our board of directors in January 2007 adopted a series of policy principles calling for mandatory, science-based regulation by the federal government. Today, we congratulate you and the leadership of the full committee in presenting the draft of the Food Safety Enhancement Act of 2009 for consideration. While my written statement contains a number of suggestions for strengthening the bill, I'll focus just now on 3 key areas of concern. Let me start by repeating those policy principles I mentioned. To protect public health and ensure consumer confidence, produce safety standards must allow for a commodity-specific approach based on the best available science, must be consistent and applicable to the identified commodity no matter whether it was grown in the United States or imported, and it must be federally mandated with sufficient federal oversight of compliance in order to be credible to consumers. We're pleased that these principles are recognized in the draft Food Safety Enhancement Act. In looking specifically at the draft, we strongly support the bill's intent in Section 104 for FDA to focus on maximizing public health by implementing regulatory standards for those specific raw agricultural commodities that it believes are most critical. The FDA has estimated that only 5 commodities have been associated with 80% of all produce-related foodborne disease outbreaks in the past 10 years, and that is where we must direct our resources. In a highly diverse industry that is more aptly described as hundreds of different commodity industries, one size does not fit all. We support Congress specifying that FDA have broad authority to regulate any produce commodities it determines necessary, but with the clear mandate to develop rulemaking that focuses resources for maximum public health benefit on those specific types of commodities for which the Secretary determines that such standards are necessary to minimize the risk of serious adverse health consequences. We also recommend that Section 104 strengthen the support for collaboration between HHS and the U.S. Department of Agriculture and all state agencies in all areas of education, research, and enforcement with regard to produce. It's important that we bring the broadest knowledge and resource base possible to assist all stakeholders in understanding and complying with FDA-set public health standards. Dealing with Section 107 on traceability, I want to assure the committee that the fresh produce industry is committed to farm-to-fork traceability of our products. As I presented in detailed testimony before the House Committee on Appropriations, Chairwoman DeLaro's Ag Subcommittee earlier this year, we have underway a produce traceability initiative to provide electronic traceability for 6 billion cases of fresh produce that move annually within the United States. This is a massive and extremely expensive long-term undertaking, but it's a commitment that we've made. However, we are concerned that the prescriptive nature of Section 107 could actually derail these important efforts to bring the most cost-efficient and cost-effective technology to bear on this challenge. As you weigh various traceability provisions, we urge that Congress set the goal, the mandate for food traceability, but not overly prescriptive requirements such as those in this bill. Rather, we believe Congress would be more effective in mandating an intensive evaluation of technologies, systems, and pilot tests that will truly lead to the end result we all desire. To that point, this legislation should set a goal for total supply chain traceability across the food industry, not single out individual food categories for traceability. Finally, on the question of imports, I believe the committee should carefully examine all of the provisions regulating imported foods to assure equal treatment and fair standards for imported and domestically produced foods. This should be a principle maintained throughout all provisions. In Section 201, we support the bill's intent to require importers to register with FDA and comply with good importer practices. The committee should make clear that this is the standard protocol for importing foods, and that the limitations and restrictions envisioned in Section 109 provide very extreme authorities to be used by FDA only in worst-case scenarios when required to minimize the risk of severe adverse health consequences. With regard to imports, we also strongly support the concept of the Safe and Secure Food Importation Program in Section 113 and urge that the bill require FDA to implement such a program with clear direction that it shall be implemented rather than may be implemented. Finally, let me mention 143 and country of origin labeling. The fresh produce industry is already required under the 2008 Farm Bill to provide mandatory country of origin labeling at retail point of sale. Our industry has moved rapidly to ensure compliance with this law and urges that those products which are already covered be specifically exempted from any new duplicative coverage under the FD&C Act. Let me conclude with a comment about public health. The very Department of Health and Human Services that regulates our safety has the dual responsibility to promote public health, but consider the fact that we need, as Americans, to double our consumption of fruits and vegetables to meet the very simple U.S. dietary guidelines. With that public health imperative, fears of food safety have no place in the Fresh Produce Department. Thank you for your leadership on this effort.
Thank you, and thank all of you. We'll now take questions from the panel, 5 minutes each, and I'll start. I wanted to start with Mr. Wall. There are many in the industry have called for prevention. Well, I should say a stronger emphasis on prevention. And many feel that we need to share the responsibility for making food safe. The FDA obviously does an important job, but manufacturers must also be responsible for the foods that they make. And one of the ways the draft before us proposes to do this is through a new emphasis on prevention. It requires companies to conduct hazard analysis to identify potential safety risks for the food they handle. It then requires that the facility owner adopt preventive measures to reduce or eliminate these risks. So, Mr. Wall, can you elaborate on how preventive controls, such as those put forth by the bill, will help make food safer? And could you give us some examples of preventive controls and how they might be implemented or applied?
Thank you, Chairman Pallone. The systems that are going to be applied in this bill are well tested. We have watched the implementation of what are called HACCP, or Hazard Analysis Critical Control Point systems, in the seafood industry, in the beef and poultry industries, and in the also in fresh juice and several other industries. The problem with the approach that FDA has been taking up until now, and the solution that your bill will bring to the agency, is that they've been trying to apply these systems one by one, industry by industry. And I think what you see here is a unitary view among industry and consumer organizations that these systems are needed across the board. They're developed by the industry, they're driven by the industry, they design the programs, but the government can use them to actually go in and conduct inspections which are much more meaningful than the ones they do today.
Well, let me ask each of you. I'll ask Ms. Bailey and then go to the others quickly, if you would respond, whether you support these preventive approaches to food safety.
Absolutely, yes, sir.
Okay, Mike? Or
Yes.
Dr. Jones?
Yes, sir, we do.
All right, great. I mean, obviously, we got a consensus on the preventative approach being a critical part of the bill. I wanted to ask about access to records, though, too. One of the new requirements in the bill references access to records. Section 106 requires that food manufacturers and producers retain records relating to the foods they produce, and upon request, provide these records to the FDA. FDA would, in the event of a foodborne disease outbreak or during an inspection, have access to information on how foods were produced, manufactured, transported, or stored. And I'll initially ask Dr. Jones, can you describe for us how this type of records access would be helpful to the FDA in the event of a foodborne disease outbreak?
Well, I mean, I think access to those records are critical in order for them to sort of pinpoint their interventions, but I also think the ability for FDA to share that data with other agencies that assist them in those investigations is critical, and that's been a huge barrier for us. I mean, I've worked on outbreaks where FDA had the names and phone numbers of people that had consumed contaminated product and would not, or thought that they could not share that information with public health departments that are responsible for calling those people and telling them not to eat the stuff. And that's just mind-boggling to me. I mean, I think it's subtle, but there's some addressing that issue in this bill.
You want to comment also, Ms. DeWall, on whether you believe that this access to records provision will help protect public health?
The access to records provision gives the agency the ability to look at plants. When they visit them, they can look at them as they're operating over time. Today, when an FDA inspector goes into a plant, they just see the four walls of the plant. They may not even get access to any records in that facility. They can look at production practices as they're happening on that day. But with the access to records provision, together with this preventive control system and this written food safety plan, the inspector will be able to go and look back at where the company has faced perhaps challenges in its operation and how they've addressed them.
Okay. Thank you. I mean, I don't know if anybody else wanted to address it, but I think that's fine. Thank you. Mr. Deal.
Thank you. Mr. Tinsel, I guess I'm going to start with you from the producer side of it. First of all, in a general context, do you see any problem or potential of this legislation creating overlaps with FDA jurisdiction and requirements to do things versus current USDA requirements to do things in our food supply?
We don't see any jurisdictional issues in public health in that sense. FDA has the statutory authority now to regulate the fresh produce industry. We do suggest strongly that there be a good coordination with the U.S. Department of Agriculture in education, enforcement. Certainly one of the keys to implementing this bill is going to be an effective structure with FDA working with USDA and state and local agencies in compliance, enforcement, inspections. That needs to be strengthened, but there's not a jurisdictional issue of competing authorities.
My understanding is that at the production level, that good agricultural practices are the primary preventive tool and mechanism for dealing with it at the production level. Do you see perhaps that an updating or improvement on those agricultural practices standards as they apply to fruits and vegetables is important, and is there anything here that would prevent that from taking place?
Yes, sir, Mr. Deal, that is an extremely important part. The FDA's good agricultural practices are called to be updated in this draft legislation. We strongly support that as the baseline guidance for all fruits and vegetables. For those specific commodities in which FDA has determined a significant level of risk, then you move into the rulemaking procedure. But that's one of the key things. It's the way we can best focus our public health resources on the greatest risk. I said in my testimony that 80% of all the outbreaks have been associated with just 5 commodities. So the basic good agricultural practices are very appropriate for all fruits and vegetables, but let's focus the rulemaking on those specific commodities that require it.
And Ms. Bailey, I believe you made the point that since we have mandated studies and pilot projects, et cetera, that those be completed before we start trying to write the rules and regulations. Is that one of the points you were making?
On traceability, yes.
Yes. It seems to me that if we're going to do the studies and the pilot projects, we ought to do that before we write the regulations, because presumably they will give us the information to guide us in the rulemaking process. So I think your point is well made. In that regard, Mr. Stensel, your industry has already put in place some traceability standards. How do you see your current efforts in traceability? How do they correspond to what's in this legislation?
I tell you, this is proving to be a massive, massive undertaking. And we are committed to doing it, even on a voluntary basis before any type of requirement. But extremely complex system of creating that interoperable system that can see the life cycle all the way through of our products. But some of the specific language in this bill, the full pedigree of each product, gives us great cause for concern. Even though we're moving down a path of hundreds of millions of dollars being invested in interoperable traceability systems, we don't think they might meet exactly the terms of this bill. So we would also strongly advise that FDA be mandated to get involved in the technology, in the pilot test, learn about each industry, and then write the regulation. It's premature to tell every industry exactly how it should be done until we have this greater learning.
One of the scares that we've alluded to here was the Mexican pepper scare that adversely impacted the tomato industry. And I guess I would ask you again, how do we ensure that foreign producers meet the kind of standards that we would need? Would it require, in your opinion, some kind of foreign producer verification system of some sort?
Well, I think the requirements in the import section are appropriate, that importers will now be required to register with the FDA, and as part of good importer practices, they will have to assure that their products have been grown in accordance with these standards. We believe that is an appropriate step to be taken. I don't think anyone envisions going searching around on every farm around the world, nor every farm in America, to be honest with that. That's simply not going to be the case. The authority should be there for FDA if they need to investigate an issue, but the basic responsibility is going to lie with the importer or the food manufacturer.
Yes or no. Does your organization represent the organics producers?
Yes, sir. We have a number of organic suppliers in our group.
Thank you. would you entertain this? I have a statement, and I think we've cleared it with your staff from the Frozen Food Institute to be inserted in the record.
Without objection, so ordered. Chairman Dingle?
Mr. Chairman, thank you. I'd like to commend the panel for their very helpful testimony, and thank you all. I'd particularly like to address my questions, however, to Ms. Bailey from GMA. I'd like to first begin by welcoming you. I'd like to follow up by thanking you for the cooperative way in which you and GMA have been working with the staff to try and resolve the difficulties which we confront. And I'd like to also express my particular thanks to you for the most helpful way in which you have behaved and the remarkable change that has occurred under your leadership. So I thank you. First of all, am I fair in stating that FDA has been so underfunded that they've not been able to provide the necessary services to protect either the industry or the consumers for a number of years?
That's right.
And as a result, they have been unable to adequately fulfill their role in ensuring the safety of the nation's food supply.
Yes, we would agree.
Unfortunately, our reporter doesn't have a nod. You got to say yes
Sorry,
or no.
I said yes. And if I could give an example, FDA has not been able to update good manufacturing practices since 1986, and that's just one example of something they've not been able to do without adequate resources.
Now, that sounds like a very serious matter. Tell us what that means.
Well, good manufacturing practices serve the basis.
Those are required both in food and drug, cosmetics, and
That's
also
right. And they're-
in pharmaceuticals.
That's right. And so the preventive controls that we're talking about, and HACCP, for example, are one step up from good manufacturing practices. You want to have them updated. And as we all know, there have been enormous advances in manufacturing and food processing since 1986 relating to pathogen control, environmental testing, all of the advancements. And FDA has not been able to incorporate them into updated good manufacturing practices guidance for industry.
Would you also agree that FDA's science base has eroded?
Absolutely, yes.
And that the FDA's information technology systems are inadequate?
Yes.
And that FDA has not been doing an acceptable level of surveillance and research?
That's right.
Would you agree that they have not conducted a satisfactory number of inspections over the years? This figure I got, which seems interesting. FDA conducted 6,562 domestic food facility inspections in 2008, 152 foreign food facility inspections in 2008. The total number of registered facilities is 378,000, but there are many more out there in the world who are shipping stuff to us. Is that a fair statement?
That's an accurate statement, yes.
Thank you. And I'm sure you agree, as you have said in your statement, that FDA needs additional resources to do their job.
Yes.
And I want to commend you very much for the way you've been working with us on the registration and the fee question. And I want you to know that we're going to try very hard to see to it that we come up with something that enables industry to work, prosper, have a satisfactory Food and Drug Administration, one which protects the consumers, but also which doesn't overburden the industry. And we look forward to continuing our efforts on that, and I hope that you will continue to give us those assistances. And again, the reporter has no nod button.
Yes. Yes, we look forward to that. I thought that Dr. Hamburg this morning laid a good basis for those discussions going forward.
I'm troubled about foreign people who deliver food into the United States. Food and Drug doesn't have the right number of inspections and inspectors at the border, do they?
No, that's right, they do not.
I'm told they only inspect about 1% of the foods coming into the United States. And that games are played oftentimes where they're turned back, rather where food shipments are turned back with the result that they go out and come in another port. Are you troubled about that?
Yes, we need strong inspections at the border.
Now, I'm also troubled about the fact that Food and Drug has no understandings with their sister agencies, with Customs, with immigration. So as a result, a lot of time, their inspectors will be at the ports, and there's no Food and Drug folks there. We ought to see to it that there's a cooperative agreement there to make that possible so that they would work together instead of ignoring each other's business. Isn't that right?
I think that sounds like a good idea, yes.
Well, I note that I am 3 seconds over time. It's a pleasure to have you before us. Thank you.
Thank you, Mr.
Chairman.
Dingle.
Thank you, Chairman Dingle. Mr. Shimkus.
Thank you, Mr. Chairman. I've got a lot of questions. I'm going to try to be quick. You all sat in the first testimony. Can any of you tell me what may cause means? Let's do Ms. Ambrosio. Do you know what may cause means?
It's a very vague term.
Okay, Ms. Bailey, may cause?
I'm not certain, no.
Okay. Ms. DeWall.
Thank you. The actual subsection says, if the secretary has reason to believe that the use or consumption of or exposure to an article of food may cause adverse health consequences. So the actual standard, sir, is reason to believe, and the may cause is in there, but it really is a standard which is very protective of public health. Thank you.
Dr. Jones
I agree with those comments.
and Mr. Stencil.
I believe that it's a much more vague standard than that.
And I hope we can work to clean up that language, and I think there's an opportunity to do that. Let me ask this subpoena question again to those who may want to talk about that. There are 3 criteria in Section 311, which I didn't allude to the first. First is any hearing, investigation, and other proceeding respecting a violation of the Act. I think most people agree, subpoena. Any hearing, investigation, or other proceeding to determine if a person is in violation of specific provisions of this Act. I think an average person would say, okay, subpoena these babies. The third one, any other matter relative to the commissioner's jurisdiction under this Act, the Public Health Service Act, and the Federal Anti-Tampering Act. Any other matter, vague or not? Mr. Ambrosio?
It's vague.
Thank you. Ms. Bailey?
Yes, that, it's vague.
Mr. Wall?
Actually, these acts are important to protect us against swine flu, against bioterrorism. So in fact, these acts, if you understand the relationship between the Food, Drug, and Cosmetic Act and these other legal statutes, I think the language may be appropriate, but
It may be, may not,
we'll
may not be,
go back
it
and
may
look
be.
at it.
Okay, thanks. Dr. Jones?
I'm a physician, not a lawyer.
Okay. Neither am I, but I pretend to be one here.
But, so my tendency is to err on the side of protecting the public's health, but I agree it's somewhat vague.
My tendency is to question the legal language of the law that may harm folks by the language. I've found the language of the law is very important, and interesting things can be done as this gets crafted. Mr. Stencil?
I think it's also quite a general standard, and do suggest it's an area to look at throughout the bill.
Thank you. Let me go, Mr. Stencil, I want to ask specifically on Section 104, which calls for the Secretary to issue regulation on produce safety standards. The language in the bill says the standard may include minimum standards for safety. This is a lot of the language stuff that I've been focusing on today. Why would we want the agency to issue minimum standards instead of the appropriate standards for safety?
Mr. Shimkus, thank you for raising that. It's actually a subject I addressed in my written testimony. I don't think we should be using such terms as minimum or expecting minimum standards. We should have the agency write the standards that are most appropriate that all producers should follow. I can tell you this, that as soon as we have minimum standards, the first thing that's going to happen is someone's going to say that's not good enough. So if we're going to go down this path, let's make sure the agency writes the most appropriate standards.
And that's that whole debate that we always have up here about some certainty.
Yes.
Industry needs certainty. If we have vague language, there is uncertainty. And with uncertainty comes higher risk because of trying to comply. That's okay, I appreciate that. Let me, Ms. Bailey, what was surprising in the draft is, and I was on O&I last Congress, I can't talk about what was the hearings in previous Congresses or what's going on this time, but baby formula has popped into this debate. And I know of no hearings on baby formula in the last Congress when I was ranking on O&I. Have there been any reported problems that would suggest that there needs to be a reason to change the way infant formula is regulated? In the premises, it's highly regulated already. Can you want to comment on that?
Yes. We are not familiar either with the origin of that provision. We noticed it in this draft, and we are, of course, aware of how highly regulated baby formula is. And we are interested in receiving further information. But it obviously is very important, as is the safety of the product and the availability to mothers and children.
And thank you, Chairman. My time's expired. I would have gone on with a pilot program. I think that's been discussed a little bit. I know Mr. Ambrosio has some comments, and I think a pilot program might be important, and I yield back.
What do you want to do? Ask who? Why don't you go talk to her a second? The problem that we have is there's an important vote in our other subcommittee. So I'd like to adjourn for just 5 minutes so that the members can go and vote in the other subcommittee, and we'll come right back. So the subcommittee, if you bear with it, just in recess for 5 minutes. Okay, the subcommittee will reconvene, and Ms. DeGette.
Thank you very much, Mr. Chairman. I want to echo Mr. Dingell's thanks to every single witness here for working with us on this legislation. All of your input has been very, very important, and none of you will be surprised to know I want to talk about the mandatory recall provisions of the bill. And I want to start with Ms. DeWall. First of all, do you think, Ms. DeWall, that the current provisions of the Bioterrorism Act are sufficient to give us the mandatory recall that we need in a robust food safety system?
No, I don't.
And why is that?
Well, the Bioterrorism Act actually didn't really give them mandatory recall, but it does give them the authority to take certain actions, like administrative detention and some other actions, when they meet a very high
But to interrupt you, it really has the one step back and one step up.
Oh,
Is that
the
sufficient to
I'm
give us
sorry.
the whole traceability? I said mandatory
Yes, the-
recall, and I meant traceability.
Okay, I'm sorry. Traceability.
So that's what happens when you break my train of thought.
The ones that, thank you for that clarification. The one step up and one step back traceability was a good first step into this area, but I think the provisions in this bill are much improved on that. What we've seen over the years since that law was passed is that the FDA itself has had trouble with identifying food products involved in major recalls and outbreaks.
Because it just doesn't go far enough forward or backwards, correct?
Right.
And Dr. Jones, you're nodding your head yes as well.
Yeah, I mean, I think, there's such a huge food production chain that if there is one point in the chain where records aren't good, you can, I mean,
You lose the whole
if
thing.
Bruno's Produce doesn't know where it came from, you could have the rest of the industry know, and you can't
Right.
get anywhere.
Thank you. Now, I want to ask you, Mr. Ambrosio, Ms. Bailey, and Mr. Stenzel, I've read all of your testimony and listened to you here today. You don't object in general to the concept of traceability, do you, Mr. Ambrosio,
No.
Ms. Bailey,
No.
and Mr. Stenzel?
No, ma'am.
And in fact, Mr. Ambrosio, in your testimony, you recommended that the secretary be allowed to design systems based on the information gathered and not be mandated to develop a specific type of system prior to those efforts, correct? And Ms. Bailey, in your testimony, your written testimony, you talked about the concept of including intermediate distributors and brokers in the labeling of bulk ingredients, the supplier, so that we could get that traceability, correct?
That's right, yes.
And Mr. Stenzel, I've got to say, the produce industry in this country was really, maybe I shouldn't say this in front of everybody else, but you folks were the ones that gave me courage to believe that we could do traceability because you're doing such a great job. So I want to commend you. I guess the issue, as I heard in all of your testimony today, is some concerns with the specific language of Section 7 of the committee draft. Would that be accurate to say, Ms. Bailey?
That's right.
And I just want to, you talked in your verbal testimony today about the tomato recall, and you were talking about mandatory versus voluntary recalls, but that made me think about traceability too, because it doesn't really matter if the recall is mandatory or voluntary. If it's overbroad, it's still, well, I guess I should ask you, Mr. Stenzel, since it's produce, if it's overbroad, it still devastates the entire market, correct?
Yes, that's absolutely correct.
So really what you want to have is the ability to quickly trace where contamination came from foods, correct? And what we've been seeing lately, I was thinking about the latest, the pistachios, where they were saying just don't eat any pistachios. Then I thought, well, what if you had pistachios that were incorporated in granola or something like that went along the way? You could really devastate a food agency. Ms. Bailey, I wonder if you want to comment on that.
I think, first of all, we are absolutely sympathetic with your goal and the importance of improving our traceability systems. I think it's a matter of prioritizing how we go about it. That's why we recommended, first of all, there's a difference between a single product like a strawberry or that is ready to eat versus ingredients that may be commingled and mixed
Right.
into additional products.
Exactly right.
And we saw in the peanut paste problem that when there were brokers involved, PCA would sell the paste to a broker who would then sell it to an end manufacturer. And that's why we included the recommendation that
Right.
that distributor label it. Now, going forward, what we have learned working with our member companies in other areas of the food industry, it can be enormously expensive when you start to deal with commingled ingredient and commodity products. And that's where we caution, and we think the legislation has it absolutely right. Let's ask FDA to first
Right.
identify cost benefit, because in the end, resources are finite.
Right. But let me just say, because my time has expired, that I really hope all of you will come in and work with us on this particular traceability language, because from the very early days of my working on this issue, what you're saying is exactly my view, which is we need to have traceability throughout the industry, but that we can't have a one-size-fits-all traceability system or technology. The key is those things be interoperable. So if you have peppers and tomatoes mixed in a salsa, that's one level of complexity. If you have that salsa incorporated in a processed food, that's another layer of complexity. And then if you have that put into something at a restaurant or any place, that's another layer. So we have to really work on that. What I'm amazed about, though, is we do have the technology, and we just need to work on it. So I hope you'll all work with us in the next week to improve this language. Thank you for your indulgence, Mr. Chairman.
Mr. Breuer.
I had to take a deep breath because Mr. Matheson and I guess now Chairman Dingell and Gene Green, you know, we've taken this trying to educate the committee here on electronic pedigree with regard to drugs. Yet now all of a sudden there's this great interest to do something expansive on pedigree with food. So I just want you to stop and ponder and think about this, Mr. Chairman, because as we move to the drug safety bill, it's the reason I went right at the FDA commissioner. You can't say I've got this level of interest in making sure that they go after tainted food, but with regard to drugs, well, maybe that's a little bit different. We're not going to send this message to the country that tainted food, bad lettuce, that's really awful. But we can have a different standard when it comes to bad Lipitor. I'm uncomfortable. Let me ask some questions because I don't think I completely understand. When I look at Section 106 and Section 107, we have sort of an all-in, and then under traceability, we have some exemptions. So I come from a very small town. I grew up on the Tippecanoe River, Buffalo, Indiana. We have 2 stop signs at either side of a bridge. That's the size of the town I come from. So I think about small businesses, and I worry. So when we think about access to records, and we're going to say requirement with regard to restaurants, are we going to include concessionaires? Does anybody anticipate that we would include concessionaires? So when you go to MCI Arena, how about when you go to the college football game? How about high school? How about Little League? You know, we make deer chili at our Little League games. I mean, what all is going to be included? How about convenience stores? How about you pull into that mom and pop gas station and they've created something? You can get elk sausage. I mean, what kind of requirements are we going to be placing, and where do we stop? Does anybody thought about? Do we, as a committee, need to have better definition as to who's in and who's out? Total silence. Yes.
Congressman, at the risk of your wrath, I just don't think that food safety is something that is determined by scale of size of company. I run a trade association that has many very small members who are going to be extremely challenged to comply with this regulation. We also have very many big members. But in last summer's outbreak, we also found that some of the issues and some of the places where people were getting sick We're the very smallest restaurants, and we've got to be able to have a system that takes care of.
Well, there's food handling. There's a difference between food processing and food handling, right?
Yes, sir.
So the people up here on this dais love to talk about all these foodborne pathogens and all these sicknesses that everybody comes down to, predominantly deals with the handling of food, right? Not so much always the processing of food at a manufactured facility. I almost feel like they're being used as a scapegoat when in fact it's other handling. Man, probably everybody here in the audience and around the country, we've all gotten sick because somebody left the mayonnaise out overnight or something. Well, when I look at the traceability requirement, we decide, I guess, farms, for example, they got to keep their records, or I guess Little League has to keep their records, or everybody that's going to be involved with food is going to have to keep their records. But we're going to exempt now restaurants and farms would be required to maintain the safety records, but direct sales by farms are exempt. What about seafood? So if we're going to exempt on the farm, we going to exempt seafood? How about that trawler that goes right out there, gets the seafood, and he owns the restaurant and the trawler and processes the food? Should they be exempted just like we're going to exempt on the farm? Total silence. See, those are the same kind of questions I have. When we start picking and choosing where we draw the line, Ms. Bailey?
If I could, the language in that section at the end is very important, and I think goes to the heart of our concerns, that there are a number of questions. There has to be a sense of what's feasible technologically, what the cost benefit is, and what the relation is to food safety.
If we're going to exempt farms, should we exempt trout farms, catfish farms? How about fish caught on the Great Lakes? What about seafood?
Yeah. I think those are all questions that need to be answered. And if I could offer, the analogy might be this is very similar to electronic medical records in that it is a concept that makes good sense, but it is not easy to achieve, and there are many reasons why it's not easy to achieve, both technologically and cost-wise.
See, it is easier for me to be able to achieve electronic pedigree in the drug industry when I have specific companies, yet I can't get cooperation here to do this, but they say that what I'm trying to do is too complex. What the heck is this? This is a decentralized model of the umpteenth degree. I'd love to work with you, Mr. Chairman. I'll yield back.
Thank you. Okay, we're done with our questioning, and just a reminder again, you heard us earlier about that you may get written questions by the close of business tomorrow, and we'd like you to answer them by the close of business on Monday. And again, I want to thank you all. This was very helpful. I can't emphasize enough that even though, our plan is to go to markup next week, that we would very much like, and we intend to, consider a lot of the statements that were made today as we move forward over the next week. And several members have commented on how valuable, your testimony is going to be as we move forward. But without objection, the meeting of the subcommittee is adjourned. Thank you.